Hi there, I'm Dr. Diana.
And I'm Dr. Shalene. Welcome to Skin Tea!
Yay! Join us as we take you through the world of aesthetic medicine. So on today's video, we are doing a get to know us so that you can just get to know us as aesthetic doctors, what we do and what's in this world of aesthetic medicine. So sit down, relax and enjoy.
And grab a cup of tea!
Yeah, grab a cup of tea please.
I'm Dr. Shalene and I'm a medical doctor and I'm currently specializing in aesthetic medicine and undergoing my training in the Harley Academy in London.
Hi there, I'm Dr. Diana. I'm also an aesthetic doctor. I trained with the American Academy of Aesthetic Medicine, already qualified. Yeah.
That's us.
That's us in a nutshell.
Yeah. What inspired me to become an aesthetic doctor was my love for skin, and I fell in love with skin when I became a makeup artist. And I realized a lot of women didn't actually understand their skin. So when I left the traditional medical field, I tried to look for where it is that I could go and still explore my passion for skin, and that's how I discovered aesthetic medicine. So that's where I am today.
Nice.
Yeah.
What inspired me to become an aesthetic doctor? So for me, it's maybe multifactorial. Number one being I myself suffered from acne. And it was severe acne by then. But I didn't like how I had to pave my way through to just find out what I need to do. So I had a conflict of interest. Do I want to do dermatology? Do I want to do obstetrics and gynecology? Or do I want to do plastic surgery? So when I was sitting down just to look at what encompasses three of them, aesthetic medicine does. Aesthetic medicine, I get to work with women a lot. So that covers the obstetric and gynecology side.
Yeah.
I get to treat some skin issues, so that goes with the dermatology and the plastic surgery. I get to improve people's appearance. So aesthetic medicine for me, that's how it came. It's wholesome. And then again, we get to deal with your mentality. We get to treat someone's mental health. So yeah, that's how it is.
Oh wow, can I redo my answer? Like so
yeah, that's
technical. Okay.
Yeah, that's how.
Good.
Yeah, so what do I miss about traditional medicine? Why is this a hard question? No, it's actually not hard. What I miss is being able to get someone from a very sick state and seeing them be better. Because in aesthetic medicine, we are ideally dealing with healthy patients. But in the traditional medicine, you're dealing with someone who's very sick and very ill. And that's something that gave me so much satisfaction. Just being able to help out someone in pain, alleviate their condition. So yeah, that's what I miss. Just being able to see that difference from a patient walking in, not being able to walk. Then on the other side, then being able to go home smiling. Yeah, I think I miss that. Yeah.
What do I miss about traditional medicine? Nothing. If I'm being honest, I think my experience.
Really?
Yeah, no.
Okay.
The relationships I made, I guess, with other doctors, and the interactions I had with the patients. I was more relationship focused in a sense, which is why I think the traditional sense of medicine didn't work for me, because there's no time for that, right? It's just see the next patient and then go to the next one, go to the next one.
So relationship is
important. And I feel like aesthetic enables me to establish that,
true,
right? There's time to actually sit and talk to someone, and aesthetics is about how someone feels about themselves, which you kind of have to explore that with somebody. So yeah, I don't miss anything. If I'm being honest.
Okay.
Yeah.
But that's an honest answer.
It is. I have to be.
Yeah. So what's my personal must-have skincare and why?
Yeah.
So I think I'll speak from what I know. I struggle with acne, so I think from someone with acne, my personal best will be a cleanser. Because that's where acne starts from, the dead skin clogging into your pores. So for me, I think a cleanser is the most important part of any skincare routine, because if you don't cleanse your face, there's still dead skin, makeup, everything on it. So none of your serums, your treatments will actually go in. But I love hydrating cleansers. A cleanser that just makes me feel so smooth after, doesn't strip off my skin barrier. Yeah, so I'd say a cleanser. It's a simple answer, but yeah, that's my.
Oh, not bad.
If I'm in
I
the
didn't
desert,
expect that,
let me
actually.
just have a cleanser and some water.
You're good.
I'm good.
Oh, that's an expected answer.
Mhm.
For me, my personal must-have right now, I'm obsessed
Mhm.
with retinoids.
Yeah, that's my number 2.
Oh my
Yeah.
gosh, I don't think my skin has ever looked better since I started incorporating that into my skincare. I love it, obsessed, love it. And then I want to mention the second one because I feel like you can't
I think we
mention the
need to,
first
yeah,
one without
yeah.
mentioning the second
I
one,
think we need
which
to.
is sunscreen. Because I just feel
Yes.
like, I mean, yeah, also sunscreen. Because
Sunscreen for me too.
don't do retinoids if you're not gonna do your sunscreen. So yeah, I'll say those two things.
So for me, if I have my cleanser, retinoid, sunscreen. Yeah, even cleanser
Yeah.
and sunscreen. But sunscreen always.
Oh,
yeah.
for sure.
But I need to cleanse my
Skin,
Yeah.
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 The aesthetic procedure I'd like to try is Botox for hyperhidrosis. So my hands get really sweaty. So that's something I would want to deal with.
Yeah.
I don't know, because I used to hate wearing gloves.
Yeah.
When I was
because
working.
of the
Yeah,
sweat.
they get sweaty. And even the gloves that had like powder in
Mm,
them. And then
mm,
when I
mm.
remove them, it's like gunk of like bits of powder in
Then
my
you go home with
hands.
everything. with
Yeah,
white
and I feel like also in public settings, you know,
Yeah.
when people are like, "Oh, hold your hands, let's pray." I
Mm.
couldn't.
Oh.
I used to tell people like, "Hold me on my wrist," because they'll be drenched by the time I'm done. So
Yeah.
I would do Botox for my hyperhidrosis.
Okay.
Yeah.
Yeah. So, which aesthetic procedure would I like to try out? I think I would go with the new booming thing.
Yeah.
Polynucleotides.
I love.
Yeah, because how it just primes your own body to produce collagen. Yeah, so you're not using external things. It's your own body that's been just primed to do it. So yeah, and I love how the skin looks after the hydration it gives, the
Yeah.
rejuvenation it gives, the
Yeah.
glow.
Yeah.
Yeah, and especially for the under eye area. So I would like to try it for the under eyes because I wear
Same. Glasses.
prescription glasses, so I have a bit of a
like the
dear.
sunkiness.
Yeah, and I know it would also get worse with ears, so I'd like to just get on top of
Yeah.
it right now.
I do
And
that
start
too.
putting
Like
nucleotides for
after my
under eyes.
hydrosis,
Yeah.
I jump onto that as well.
Yeah.
For sure. Okay. So my thoughts when it comes to like natural aesthetics and like a more dramatic, you know, I like a more natural look to things. I like it if my friend is like squinting her eyes and like trying to figure out what's like
What you look like
what have you done? You know what I mean? I'm not trying to have like this like frozen look of like, you know.
Yeah.
So I definitely am for natural because also I don't want people to take away themselves out of, you know, the experience.
Yeah.
I don't want to look like the next person. I still want to
That's
look like Charlene.
Yeah.
And so I think the approach towards aesthetics should be in a more natural way because then I'm suiting it to you.
How your natural
Yeah,
features.
so how your natural features
Yeah.
are. Yeah, so that's what I'd say about that.
Yeah, and I think my answer is close to the same, natural versus the dramatic look. I would say beauty is unique.
Yeah.
Yeah, if I didn't have this nose, I wouldn't look like this.
Yeah.
If I change it too drastically, my whole face would change. So I'm also for the natural look. I believe that there's a space in aesthetic medicine for natural looks.
Yeah, for sure.
The issue is on the internet, people mostly see the exaggerated looks. But I'd like to also challenge people. There are so many people who are walking around who've had aesthetic treatments.
And you would never,
and you'd never know. What you'd say is black don't crack. But black does crack.
Hello.
Black does
Yeah,
crack, but
it
what
does.
those black people are doing is, the procedures. These are medical treatments that we do. And yeah, you can look natural. And
And why
need this space for
not?
that.
Like,
yeah.
that's my thing. Like, don't be scared to explore it because you feel like, oh my gosh, I'm not going to be the same.
Yeah.
No.
Yeah,
you
because
can actually...
And before that, there's a consultation with your doctor. And also your choice of doctor will also determine if you come out looking natural or dramatic because the doctors will know how to say no.
Thank you.
And there's some who will be okay too, even though you want too much filler.
They will do it.
They'll do
Yeah.
it. But
Yeah.
if a doctor is a nice doctor and wants to just maintain your unique features and your unique beauty, yeah, we'll just go the natural way.
Yeah.
Yeah.
At least we agree on that one.
Yeah. There's something I learned in class.
Yeah.
There's this thing, there was a conference going on and everyone had the same face. What you mentioned,
Yeah.
everyone now you all look the same. So I don't think that's how it
I don't think that's cute.
Just focus on your own
Oh,
unique
wait,
features
let me
and
not say that. What you want.
yeah.
If you want the dramatics, okay.
Yeah, it's fine.
It's also what you want.
Yeah.
Yeah. So, given the chance, what would I change about myself, physically speaking?
Yeah, physically speaking.
Yo, it's a list.
Not even change. Improve. Yeah.
Improve.
Yeah.
Where do I start? I can start head to toe. Okay, let me stick to my face.
Mm-hmm.
What I would change is I have this I also have sunken eyes. I've just always had them since I was a child. Actually, that's the reason why I even started concealer and stuff like that. So I would want that gone. The hollowness under my eyes. My forehead.
What about it?
You'll not see my forehead now because of the wig. But
So much.
I push my hairline a little bit. A little bit. I have a typical East African forehead. So yeah, that I would change. And yeah, I think that's all about my face. Yeah. If I go down, we will stay here the whole day.
If given the chance, what physical attribute would I improve about myself? Yeah. I don't know why it's a tough question. I thought I had an answer
you
to
love
this.
yourself. That's so nice.
But let me see.
Yeah.
Face
We can stick face up.
Change, not just change, maybe improve. I will maybe try some radio frequency here and there.
What are you changing?
Improve the Venus of my chin. I don't know if I look different. Do I look the same here? And if I do this,
let me see.
is
And
there
do it.
more youthfulness?
And then?
There is some more youthfulness.
I like how you're trying to
I'm trying to do a lift.
So you want to lift?
But that's what I'm saying. It's not something I can do now.
Okay.
But in a few years, because as we age, this place becomes boxy.
It does.
So I'd always want to, let me say this, I'd like to maintain my
I get what your jaw
inverted
structure
V.
over here. Okay.
Yes. And my cheekbones. They've always been naturally high.
Yeah.
So it's something I wouldn't like to lose. So if I were to change something about myself, if this changes, I will definitely
Okay, but that's
do.
If it changes. But what about now, Diana?
Abs. I'll do the radio frequency to just get me tighter.
Okay.
Tighten up my abs area.
Okay.
Also, I have a lot of cellulite, by the way.
Okay,
a lot of
so you'll
loose
do with
skin,
your
loose-
cellulite.
Yes, I'll do skin, a skin tightening treatment, a full body skin tightening treatment. Actually, that's
Fair
my
enough.
answer for my abs, my thigh area, the cellulite. Yeah,
Okay.
just to look toned.
Okay.
Even the glutes. Yeah, because I wear a lot of bikini.
Okay.
Yeah, so it will be good for my body to look tight. So my answer is I'll try a full body tightening.
Finally, she got something. So how did I meet Dee?
Yeah.
Dee slid in my DMs. That's what happened. She slid into my DMs and
Shoot your shot, guys.
really,
yeah, I should.
yeah, and then we just met for coffee because we realized we were both getting into this field and we clicked, and that's how we are here, right?
Yeah. So that's the answer. I couldn't find or couldn't see any other aesthetic doctors in Kenya. Actually, when I was starting the course, I didn't know there was any other who's done it. Then I came through your Instagram and I'm like, oh, she's Kenyan. Actually, at first I thought you're like South African.
Oh, really?
Or Zambian. I don't know. I thought you come from the south.
Right.
Yeah, because you're African and you're in aesthetics. You're most likely in the
I see
southern
what
part.
you're
So
saying,
I
yeah.
almost just scrolled through, then I checked the bio, I'm like, she's Kenyan. Yeah, so it's good to also
just
collaborate, reach
yeah.
out, talk, share experiences, and yeah, that's how it's been. So,
Yeah.
yeah.
So if I wasn't an aesthetic doctor, I'd be a midwife. Yeah.
That's a
Yeah.
nice answer.
I'd be a midwife.
Oh, yeah.
I love the birthing process. I think that's the part of OBGYN I really enjoyed. And yeah, I think birth is a beautiful thing, and just to like support a mother through that, I would do that.
I have to go again with obstetrics and gynecology. That's what
okay.
I wanted to do actually. I love working with women. I like taking care of children. And in obs-gyn you get to do both, but especially helping women. Yeah, so I've always wanted to do obs-gyn.
Oh,
I
okay.
enjoyed the surgical obs-gyn cases.
Okay,
Even
now
when I
I
was
hated that.
even when I
Yeah.
was an MO, just a GP, I did a lot of C-sections. I was always in the maternity department. There was a time I was in a hospital for 2 years and I just worked in maternity. Yeah, so I used to do C-sections. Help
So
with birth.
I didn't like CSS.
You
I
did-
didn't
I
like the
liked-
surgical part of OBGYN.
And that's why for me I feel like aesthetics was also easy for me because I know I'm good with my hands. I was really even with my suturing, the cutting, I was really good with it. So I was like, there's no way I will struggle with the needle. And maybe
That's what you like.
That's what I like.
That's
you know?
what you like. Yeah.
No, you
We'll get into
understand.
that.
Yeah.
How would I describe Diane?
Yes.
Ooh. Are we going into like personality or just like in general how I describe you? Like I can go
for
anywhere.
it. Go
Okay.
for it. Anyway, it can be a fun thing, a serious thing. Anyway. Yeah.
Okay. How would I describe you?
In 3 words.
You're kind,
Oh, thanks.
which is actually really hard to come by these days. I mean, we know our stories. Kind. She's really kind. You're really you're a girl's girl.
Thanks for saying that's true.
You're a girl's
That's
girl for sure.
I know.
Yeah, you're definitely a girl's girl. And organized.
Oh, nice. Oh,
We had this conversation, but
take
she's
it.
really organized. Yeah.
Alright, thanks. How would I describe Dr. Charlene in 3 words? Number one, are you waiting? Beautiful. I think, guys,
Thank you.
melanin that's
I mean, I didn't need to see say yours, but
Yeah,
oh,
so,
thank you.
but again, one thing I noticed with you, the first time we met, I was like, this chick is smart. Like, yeah, you are really quick with ideas. Your ideas just come out and they're quick and they're well thought through. I like how I like your thought process. Yeah,
Wow.
I find like your thought process is well arranged and you can come up with a plan. For me, I'll have the ideas, but they're like here, there. I have to sort them out. For you, I feel like there's how you articulate your thoughts and just bring, it just in a
I
smart.
don't think I've ever heard someone say
Yeah,
that.
it is.
Thank you.
Yeah, then the last one is supportive. Since we met in this field, number one, you're even open enough to meet up with me, and you could have been like, "Who's this? I don't want to work with you." Yeah, but you've been supportive, helping me know the things I don't know in aesthetics, as I support you in the things you don't know. She's very good with like skincare stuff. But there's so many other words that was
I know.
past three. Yeah.
Aw, it's so nice to know you.
Nice to meet you too. Yeah, so that's it for today.
Yep, that's
Yeah,
us in
that's
a
us.
nutshell. Of course, there's more to
Yeah.
us, duh. But yeah, I guess you guys have to stick around to kind of
Stick around
find
to
out those
find
other
out.
sides to us.
Yeah, so always watch, no, not always, try to watch our videos if you can.
Yeah.
We'll try to be more consistent with this. And yeah, welcome to our aesthetic medicine field. Also, we are doctors at the end of the day. If you have anything you'd like to book a consultation, you can reach to either of our DMs and we can try to help you as we can. So till the next video, bye.
Bye.